So, hello to all the viewers. Today we have with us Dr. Bharanidharan, uh, who is rank 9 in the AIIMS merit list of DM Neurology and rank 13 in the common merit list. So, it's a very happy moment for me to be doing an interview with him. So, welcome, Dr. Bharanidharan.
Thank you so much, sir.
Okay. So the first ever INISS exam, securing such a great rank. Well, what were your initial feelings, seeing that rank and getting sure that, okay, I am going to be in one of the central institutes?
Actually, I am feeling very happy, sir. A good kind of feel only, sir. My focus was like, I should do it in a central institute only. And thankfully, with some God's grace, I have achieved this, sir.
Okay. So, Bharanidharan, through this interview, we are trying to give the future INISS aspirants a guidance. Like if they want to prepare for INISS, how should they go about it? That's what we are going to discuss today. So to begin with, before we go to the further details of the exams, introduce yourself, your MBBS days, MD days, from which college?
Actually, I'm Bharanidharan, sir, 2011 batch MBBS from Trichy SRM Medical College, Tamil Nadu. And I did my post-graduation MD 2018 batch from Jibmar, Pondicherry, sir.
Okay. So when did you finish your residency?
I finished my residency in March 2021, sir.
All right. Okay. So now the first question to you is, many of the viewers would want to know this. INISS, how is the exam pattern? Because, this is the first ever INISS. So those 80 questions, can you just tell the viewers a bit regarding the pattern of questions, both from the neurology section as well as the medicine section?
Okay, sir. Actually speaking, when it comes to the proportion of questions, out of 80, I feel 55-25, sir. 55 is of neurology and 25 is from general medicine aspect, which covers all other branches also, sir.
Yeah. So just, if I interrupt you there, when the pattern was announced and we did a mock exam also, though, we had a guess at that time, we made this exact like 55-25 for that INISS mock exam that we conducted also. Okay. All right. So go ahead. 55-25.
55. I felt really, when I came and then recalled my questions in a short paper, I felt that there were around 25 medicine questions and 55 neurology questions. And in neurology, to be specific, which has occupied a more bulk is like stroke and seizures. Obviously, the stroke and seizures has occupied almost around 18 to 20 questions, this both topics together. And stroke, it means more of clinical aspects, like treatment modalities and newer trials. And those aspects has occupied at least some 5-6 questions around that tenective place, these trials that alone have occupied again and again on the same thing, DWI, flare, everything that has occupied around 6 to 7 questions, and seizures. So I feel the bulk of neurology is from stroke and seizures, and it covered other parts also. The neuro-ophthalmology part has had some 6 to 7 questions, scotomas, field defects, and this and all as demyelination also, sir. If I say that one person has to do thoroughly, means without stroke and seizure, they should not appear for exam, I feel, because that is like a major chunk.
Okay, all right. And so you say that seizures and stroke are the most core areas for INISS exam. So, you had done your stroke and seizures well, because you have already watched the Dr. Tutorial's lectures. So did it cover the questions, everything?
Yes, sir. It covered as almost every question it has covered, sir. Okay. If it is 20, I feel it is 17 to 18 will be from the part which is covered. Okay. And you should have a depth of understanding also. It's not like nobody is going to give you the exact line, but every concept has been well explained over that.
All right.
Especially the treatment aspect of stroke was covered in such a beautiful way. Everybody, if a subscriber is there, should watch at least once the stroke treatment aspects.
Yeah, I think, we have covered stroke in detail also.
Yes, sir.
I've always felt in whole neurology, any entrance exam you take, INISS or NEET SS, I think the rank deciding questions are mostly going to come from stroke, because it is a vast area and you have got to have a solid knowledge, especially the treatment part. And as you said, there were many questions from the treatment, correct? No? And the recent trials also. All right. And even, in our WhatsApp groups also, I periodically used to mention all the stroke related trials, you have got to know it, because they are going to ask you maybe trials related to antiplatelets, anticoagulants, all are actually very, very important. All right. So moving forward, stroke, seizures, very important. Now, overall, if you say the difficulty level of the neurology section, how would you rate it in the difficulty level?
Difficulty level, see, sir, you want me to tell about like for 100?
Easy paper, or is it like a moderate paper or a tough paper? Considering any mock exam you have done with doc tutorials, you just tell me the level of toughness of the exam questions of neurology.
Tough. It's not very tough, I feel. It is a moderate paper, sir.
Yeah, I had an interview with Vedang, who's our student, and he got a top rank. He also said the same, moderate to tough range. There were several questions that could be easily answered, and some questions, slightly on the tougher side. That's it. Because this is very important to understand. When a candidate prepares for neurology, he should be anticipating the questions. He should understand that there will be certain simple questions and a good range of moderate level questions and a few tough questions. So there is a definite range for that. And out of the neurology questions, you would say that most were in the moderate to tough range. And what about the medicine segment of the paper?
Medicine segment of the paper, I feel like in COVID alone, some 2 to 3 questions were covered, sir, actually. So it's like any recent updates, we should be thorough with the whatever is happening around. Like I feel COVID questions. And the thing is, in mock exam also, you have given some 3 to 4 questions on COVID.
Yeah.
Drug and treatment you have given, sir.
So, and what do you say about the level of toughness of medicine questions? Because for NEET SS medicine, usually the medicine questions are not very tough. So just tell us about INISS, the level of toughness of the medicine questions.
Yes, sir. It was not like a factual questions. Okay. I don't feel it like one-liner. What is this? What is that kind of questions were not there from medicine.
Okay.
For example, this COVID vaccine was asked, and every line has a valid point. You should know about side effect. You should know about what is the newer vaccine. And tocilizumab was given, and everything has been covered within the question only. Okay. And you should apply. So that is like concept based. You have to apply over there. It is not a single line. You should know some clinical approach, or you would have seen once or twice those cases. That also will help you, sir. I don't feel it's like factual.
Okay, so which means you're giving a very clear message to the future aspirants as well. You've got to have a good understanding of medicine as well, because before the INISS, when we had separate central institute exams, AIIMS had only neurology questions. NIMHANS had medicine questions plus neurology, but the medicine questions were very simple. In fact, I've seen most of the papers almost NEET PG level only, but you are giving a clear message. Yes, you have to prepare for medicine as well if you want to get into the central institute. So it's not just learning neurology alone. If you want to get into neurology in NIMHANS or AIIMS or Sri Chitra or JIPMER PGI, you have got to give importance to medicine as well. So this is a call out to the residents as well, because many of the residents preparing for the exam, they might just learn neurology alone, but remember, neurology, yes, but along with that, medicine part also. All right. So regarding your preparation, so you said that after your course and you started working, and then, you had subscribed to doc tutorials, correct?
Yes, sir.
So with doc tutorials, you watched all the lectures of doc tutorials?
I actually, from the neurology part, I have watched everything, sir.
Okay.
Including stroke, seizures, and LM and everything I watched, but I could not make out more of general medicine videos. So I have those actually.
You did not get enough time because I think, you were working also. So you were concentrating on the neurology videos. Okay. Now, coming to the results. So once the first round of results came and you were selected for the interview, now, how did the interview actually go? And see, for the viewers, after the results itself, with the candidates who had qualified, we had formed a separate group and we had done mock interview sessions as well. In fact, the day of announcement of results itself, I had shared the previous year interview questions because I've been doing this for last few years. That is conducting mock interview sessions as well, because AIIMS exam used to have mock interview sessions before also. So I have already shared the previous year questions asked to toppers, which were forwarded to me by my students who were the doctoral students at that time. So immediately after the interview, they had sent me all the questions, which I shared with you also. So I just want to know, like, how did those mock interview sessions that I conducted help you in your actual interview session, and how similar was it?
Yes, sir. Actually, one thing is like people whoever got selected in that list might be knowing something, sir, but they do not know how to put it up. When a question is being asked, when an approach is needed, NCQ might be, they may be knowing the facts or concept, they will understand and accept. But to attend an interview, you will be needing a guidance actually. That was, I feel like it, creating a separate WhatsApp group for those qualified candidates and taking efforts and conducting in multiple small sessions of interview really helped us a lot. I feel that is the reason why my common rank was 13. That has been pushed to 9 in interview. I think they have given 16 out of 20. I watched all the sessions. Like those 2 days, I was continuously with you only, following you and how to approach the clinical questions or how to approach an image. So that was really helpful.
In fact, the last session exam, we had conducted multiple days of interview. But here, after the actual announcement of the results and the date of the interview, there was just 2 days gap. So that is why we had to do marathon rounds of interview. And I think you attended all the sessions as well.
Yes, sir.
So you had improved from that rank 13 to 9. So just tell us, what were the questions, in your interview, and what do you think actually went right for you in that interview?
Yes, sir. One thing I wanted to say is like, it's not like every time you will be getting an image. It might be all clinical scenarios also, or any kind of questions you should anticipate for a interview, sir. What I got was like, everything is a clinical scenario. The first question was, shall I discuss about my question?
Definitely, yes, because the viewers will definitely want to know about the questions asked to you, so that somebody watching the interview of yours, preparing for the next exam, once they qualify, can go through these questions as well.
Definitely, sir. So the first question was like a 26-year-old female who presented to us with the complaints of fever and headache for the past 4 days, followed by irritability and altered sensorium. This was the stem of the question. And they asked me, what are the differential diagnoses or how will you approach the case? Okay. Since it is a short duration fever with altered sensorium and headache, I told them I would like to think in terms of CNS infections. So I didn't jump like meningitis or encephalitis. I told I would like to think in terms of CNS infections. In CNS infection, these are my possibilities, like that. Then they further proceeded, like leading questions were asked, were pregnancy important in this scenario or cardiac disorder important in this scenario? Then I was like, yes, pregnancy, sometimes postpartum CVT can present with fever and altered sensorium, and sometimes your infective endocarditis, young lady, rheumatic heart disease possible. There might be chances of infective endocarditis, which might have thrown an emboli. When I told about this postpartum CVT, then they further proceeded with what are the imaging of choice and what are the findings you will see. This empty delta sign, cord sign, that and all I have explained to them. And after all this, they told, okay, this is not there, that is not there. Then finally, he gave me, it was like, he has given leading questions so that I can answer kind of thing. So he wanted to know about those things, and then he gave me an LP scenario, liver function scenario. Total cells was 200, of which 60% are lymphocytes, proteins 120, and glucose was 40. So this was given. So what could be your diagnosis, they asked. Then I told, like, sir, my first differential would be always tubercular meningitis in this case. Then he asked me, okay, how will you treat tubercular meningitis? Sir, you have to give ATT for 9 months. Then steroids must be given in a tapering dose. So 6 to 7 weeks, it has to be continued like that. Then I told. Then he asked me about intensive continuation phase. So with this, first question got over, sir. Okay. So then he moved to the second question. The second question is like 20-year-old young boy who had a long duration history of headache for 4 years. He has both unilateral as well as bilateral headache sometimes, throbbing in nature, which is associated with vomiting. So what are the possible differential diagnosis? How will you treat an acute and chronic? So when they gave this history, then I analyzed the stem. It was looking like a long duration headache. A long duration headache without any change in the character recently, I would like to think in terms of a benign or a primary headache syndrome, I told. So following that, I gave my DDS migraine. And when I told migraine, he was asking me about the types of migraine. When I told that, then he asked me about acute management. Then I classified, sir, if the disabling, whether it is severe, mild to moderate. So then I will, whenever so only oral drugs in the initial, then if it is severe only, I'll go for subcutaneous or IV preparations. Then after that chronic management, he asked about the drugs which are given for prophylaxis.
Okay.
I told that, sir. So following that, the second question got over. I was expecting an image for the next question. Definitely I'll get an MRI, but obviously it was also a clinical scenario.
Okay.
A 6-year-old female who presented with acute onset paraparesis with urinary difficulty for the past 3 days, added a point that she had a history of fever some 6 to 7 days before. So what are the possibilities? In my mind, it was running like 6 days history of fever before. Now there is a paraparesis. It can be any transverse myelitis. But I didn't jump to the diagnosis. I told whether I asked the UMN or LMN, sir. Can you tell about the examination findings? Is spasticity, reflexes? Then he gave it is totally flaccid, areflexia, and plantar is mute. Then I told, sir, it could be two possibilities, sir. One is transverse myelitis, or GBS also can have this kind of presentation. Since urinary difficulty has occurred in the very early setting, it could be a transverse myelitis which is occurring which is in a stage of a spinal shock. So after telling that transverse myelitis in the stage of a spinal shock, after asking history, I think they were okay. Then they were asking me what's the next. So LP and imaging has to be done, sir, like that I told. With that, they didn't proceed further. Okay. They said, okay. And then they winded up the interview, sir.
So if I just summarize for the viewers, see, out of these three questions, what I think went right for Dr. Bharanidharan was with the way he approached the headache question, the way he approached the paraparesis question, rather than just the diagnosis alone. Because even in the first session, Bharanidharan, like after the results were published, we had interviews, like mock interview sessions also. I had mentioned that never jump to the diagnosis. Your approach is what is going to be assessed. And he went with the right approach. So right approach is important. Like rather than saying, okay, this is a migraine, first saying this is possibly a benign headache, because there are no red flag signs and there is no recent change in the character of pain, which tells you a long-standing headache. Okay, I'm thinking of a primary headache, mostly a migraine. And even the other question also on neuroinfections, first saying it is a possible neuroinfection and then taking questions from there is very, very important. So I think, Bharani, I think that actually went right for you in the interview also. So, thanks a lot for clarifying that to the viewers also, because many of them will have this doubt. Many of the candidates who have qualified will be having knowledge level, which is very good. Obviously why they have been selected for the interview round. When it actually comes to the interview, it is a different skill. You agree with me, no? It's a totally different skill for the interview round. So that's it. So one last question to you. There are many residents who are listening to you, first year resident, second year resident. So just tell them that how was your journey through MD General Medicine, and what all experiences you have gained out of your residency in your college in Jipmer, and how to go about residency and how to enjoy medicine.
Medicine, for me, medicine is an emotion, sir. They say, no, for me, medicine is an emotion. Till my second year, I was feeling like I should remain as a hardcore physician. A physician will be knowing everything kind of. So that kind of physician I wanted to be. Yeah. But in my first and second year, I didn't have much time to read actually. For us, it will be very hectic only, sir. Jipmer, it is round the clock. And in first year, like every 1 or 2 days, in alternate days, we might be having night duties. We have to take care of our patients, ICU, everything was there. And meanwhile, doing that also, it is really helpful because we were able to see many of those cases. We were able to see NMO, we are able to see MOG, we are able to see autoimmune encephalitis, paraneoplastic cerebellar degenerations. Okay. I think it is matters, sir, actually to see more number of cases.
Correct. Very good.
And this paraparesis also pot spine. One patient with vertebral dislocation, one patient with pot spine. So many causes will be listed. No, like one causes we were able to see in that. CIDP patient getting IVIG, CIDP patient going for plasmapheresis. Everything we have done those treatments.
Right
And,
in the residency days itself.
Sir, one thing which I would like to know, one thing was like, it was a solid point on my head one day. A myasthenic crisis patient, she was in ventilator, and we are procuring, we are calling the blood bank for plasmapheresis. We are calling them to bring the machine for plasmapheresis. One small thing which I had done initially was like, that time, that was the first time I am seeing a myasthenic crisis, probably in my first year end, I think, sir.
Okay.
In my UG, I didn't see a crisis. I know myasthenic crisis, what it's mean, but I haven't seen. One of the peripheral places somewhere it is linked, they have given levofloxacin for the.
Okay.
My ICU consultant asking me what is wrong. Then only I came and noted that what are the drugs like macrolides, quinolones, these are all contraindicated. Like many, I feel rather than knowing line by line of medicine, I have seen patients that has helped me in understanding about the medicine. Yeah. Coming to the neurology aspect, everybody, I feel like even if it is not in the first or second year, at the end of the second year, residents will have kind of philia towards some subject.
Yeah.
Like towards some subject.
An inclination towards a particular subject. Correct. Especially after your specialty postings. Right?
After the second years only, we will have peripherals, a cardio, nephro, immuno, gastro, kind of neuro. So then I made to think like, okay, neurology, I'm more favoring towards neurology. So I started reading neurology. The thing is, for residents, MD residents, whoever is preparing for entrance also, other subjects I don't know. For neurology, Harrison has given beautifully many things. We have to read or go through Harrison definitely, sir. Okay. It's not the second volume which contains Harrison theory. It is everything. The clinical approach. First volume, clinical approach.
You are also saying that there was a good number of questions from neuro-ophthalmology as well.
Yes, sir. Neuro-ophthalmology also. Sir, I went back and checked that this junctional scotoma seen in paracellular or meningitis, it is there in Harrison. Hypotension for AIIMS, that is also that AIIMS has been mentioned in the Harrison.
Yeah.
I feel that little part has so many hidden lines in it.
Correct. So you have even the AIIMS question they asked about the respecting the vertical meridians, horizontal meridian, all those concepts are there in Harrison also. The thing is that many of them skip the first volume neurology part. So they think, it is not important. We just go with the second volume.
It's like I also made that question wrong. Then I came and saw that this is there. At least once we have given a read through this.
Yeah. Okay.
I felt that is one thing, sir. So I feel like if I wanted to say something for like juniors, I feel like read Harrison thoroughly.
Okay.
Harrison.
So these are very important words of advice, from your side. Yeah, carry on. You were about to say something.
Sir, Harrison meaning, I feel like clinical approach to neurology first part. Then there is autoimmune or paraneoplastic encephalitis. Then neuroinfections, neurocritical care. Finish this first volume, then coming to the core neurology.
Okay, right. Many of the candidates who are aspiring for Central Institute Neurology would definitely be benefited by your interview. So what about you? Have you gone through any previous interviews of any of our toppers, any of our students, which actually helped you as well?
Yes, sir. Actually, Ravi Prakash sir from NIMHANS.
Yes.
So I have seen his thing. And one of our friend, Dr. Suhas.
Okay.
Suhas, I was in direct contact with Suhas. He used to guide me. He also followed doc tutorials, sir.
Suhas was one of the earliest candidates to join at that time, and he was with us throughout the journey. And in all exams, he would be either in the top 1, 2, 3. So he was very consistent also. And at that time, most of the exams that he wrote, he was topping.
He is topping. PG, I
still remember, he had a tough time initially because that time he just finished his MD. In fact, the exam was not happening. There was a postponement due to COVID. So initially, he was a bit apprehensive where to join. My residency exam is not over. But finally, everything went right. And finally, he got the seat in NIMHANS. Okay, so he was topping, all the central institutes like AIIMS, PGI, NIMHANS exam, everything he was actually topping. All right, and even Ravi Prakash also was my student. So I still remember about Ravi Prakash. He is a very bright student, and initially he gave the AIIMS exam, and he could not do well in the interview round that time. So he was a bit disappointed. So I still remember I was a bit disappointed. I had a talk with him, and then he prepared for NIMHANS, and I still remember the day. He was very excited the day the results came, because he worked so hard. He was very, very determined that NIMHANS I should get. So again, somebody who's so much in love with neurology is Ravi Prakash Singh. I still have contact with him from NIMHANS also. So good. So I hope that those who are watching your interview also will definitely be benefited and motivated, and to take up also neurology, and the approach how to go about the INISS exam you have beautifully covered. So thank you so much, Dr. Bharanidharan. It was very nice talking to you, and all the best. Become a very good neurologist, and very soon in the years to come, we will meet in some neurology conference. So you have locked your choices now. You're just waiting for the allotment of seats, and all the best to you. Thank you so much.
Sir, thank you for your untiring work towards students and teaching. It's like really inspirational, sir. Thank you so much.
Thank you. Bye.
Thank you, sir. Bye, sir.